Hi, everyone. Thank you for joining us for CTEL's webinar series with Penny Semple. She's a CTEL advisory board member, but she's going to be talking today about identifying cost-saving digital health burnout interventions. And I know she's got some great research and data and burnout protocols as well that she's going to be discussing. But as I noted, Penny Semple is a CTEL advisory board member, and she's also an attorney and CEO and producer of StressPal Inc. An award-winning resilience provider. And Ms. Semple provides decades of experience in mediation, conflict resolution, and health advocacy. And she works in collaboration with medical professionals in both hospital and outpatient settings. And she pioneered integrative health education and life coaching as an adjunct to Western medicine care. So it's my pleasure to introduce Penny. I'd like to hand it off to you for a brief introduction, and then we can get started today.
Okay, well, thank you, Ben, and thank you, Krista, for inviting me to be here today. I'm Penny Semple, and I know that we all here share a grave concern for the complex struggles that are facing healthcare today. I mean, with shortages, retention, finances, and delivery of care are top of mind for healthcare leadership and teams. And if there was a single bullet that could fix the problem, it would have been shot. This will take a multifaceted, collaborative effort and thinking out of the box. In today's discussion, I'll give a brief overview of some of the pros and cons that are emerging in research and studies, looking at telehealth's contribution to burnout. Is it helping or hurting? And then I will drill down to review the science and some of the novel ways that digital health interventions can help promote organizational as well as individual resilience, psychosocial well-being, and stress reduction, and open and transparent communication, fostering trust, respect, and functional interpersonal dynamics. And these are bedrocks for a great place to work. And the good news is that digital health intervention tools can be adopted and readily implemented with progress in short order. I want to just tell a little bit about my own background. I was a UC Berkeley graduate in psychology. My job was in a clinic, a pretty pioneering clinic that was doing stress management integrated in a mind-body approach. I was the person who was doing the guided imagery and the biofeedback training before they went off and saw the doctor for their migraine headache or whatever other condition they were faced. And I'll never forget that first time I hooked up a patient to a GSR and I asked them to think about something that had been upsetting to them recently. And boom, that needle just popped up 2.5 seconds later. And they'd been thinking about a car that cut them off on the road. But that connection between our thoughts, our feelings, and our physiology is very dynamic and has been extensively studied over the past 30, 40 years. So when I get into some of the intervention strategies that I'll be talking about today, these are very well studied over decades with extensive peer-reviewed literature behind them. I then went back to UC and I got a degree in law, and I found myself pretty quickly focusing on conflict resolution. And I noticed that I started introducing these practices, stress management practices that I had done in my earlier years. And it would help people change the lens and shift their perspective and help them move more toward a collaborative posture and off of a rigid, often hostile position, as you know, people can be in adversarial situations, not unlike what's going on in healthcare. I was invited at one point to come into the hospital to start developing a pioneering protocol for ICU patients, and that led to actually a 20-year collaboration in the hospital. I left my law practice and I started exploring and experimenting and working with doctors to develop protocol around patient self-care. This led to about 6 years ago when I saw the alarming rise in burnout within clinicians and the pressures that they were under to develop medical grade educational tools specifically for the healthcare workforce. And I see the opportunity for telehealth and digital health tools to play an expanded role in promoting healthy work environments and bringing forefront knowledge to the entire healthcare workforce. So let's jump on in. And I have a few slides, and if you'll bring those up, that would be great. The Surgeon General has weighed in here. Okay, let me just say, okay, a moment to put that in perspective. Next slide, Ben. Okay, the Surgeon General has weighed in, as you probably all know. We have serious concerns about projected shortages, about 3 million essential low-wage workers in the next 5 years, and a projected shortage of about 140,000 physicians by 2033. This really calls for solutions at scale and to create sustainable work environments. Next slide. Stress levels are high across the workforce, and rates of burnout do vary by role and by in different studies. But what we do see, and this is one of the first studies was reported in the Lancet, this large-scale survey, is that high stress levels are experienced by many of the lower wage earners, the medical assistants, nursing assistants, nurses, social workers are extremely high, as well as administrators and other health professionals in other roles. Burnout also varies in terms of who is more impacted. Physicians, of course, more than 50%. Again, this will vary depending on different studies, but higher even in nurses and in pharmacists, which is very interesting. Higher also in women than in men. The U.S. Department of Labor, interestingly, when we look at what is driving people from their work, what's the number one reason? I was surprised to see that the answer is not feeling valued. And you'll see here on a slide that was also reported in this Lancet that they noticed a correlation. There was the odds of burnout in that survey were 40% lower in individuals who felt valued. And this will be a point that we're going to come back to later, but just hold that in mind. Okay, next slide, please. So we've been in kind of a period that some of the leading researchers in burnout, kind of Tate Shanafelt, speaks to, calls like Wellness 1.0. We started to become aware there's a problem back, a decade ago, and started, some organizations took the lead to start initiating implementation of intervention strategies. But there came to be this polarization of, it's the workforce that needs to sort of toughen up. No, it's the workplace that's burnt out, and this conflict and kind of adversarial posture, of who's to blame. Well, the problem is the question here. We have gone on from then to do a lot of research around this issue, and the research does emphasize the systemic, structural, and cultural factors that weigh heavily in as contributors to burnout. And in fact, it kind of an estimate of like 80%, 20% individual factors. But the problem, we need to dig deeper here. And I'll be sharing with you how a new paradigm, how we look at this and how we're moving into Wellness 2.0. Think about a firestorm, a raging firestorm. Do we put out the fire? Do we help the workers? We do both. We both need to look at the cause. What's causing this fire? How do we put this fire out? And we also, each of us as individuals participating in that effort to put out the fire, we want the best PPE we can have, and we want the most current knowledge of how to take care of it. And the analogy here is around what are those factors within ourselves that help protect us in this environment, and how do we take care of it so that we can more effectively, as a group, put out this fire and hopefully its cause. So I would say that the question, instead of who's to blame, is let's ask instead, how can we better lead and work together to prevent a cohesive burnout prevention program? Next slide, please. So first, we've got to take a look at, what are these workplace contributors? And there have been numerous studies that have looked at workplace contributors to physician burnout, very limited studies looking at other roles. They won't be identical parallels, and between organizations, these may vary, but, top line here, all of these matter, and all of these are coming up in studies, maybe different percentages and different research. But inefficient work processes, that's all around frustrations and barriers in practice. Documentation that is lacks meaning or is below the top of license. Excessive workload. These are, of course, your long hours, the excessive documentation, administrative tasks, not feeling valued, recognized, and appreciated. These other ones are also very important. And you can see in looking at this list that many of these relate directly to interpersonal dynamics. Others more to policies and practices, issues like payer pressures, things that are external stakeholders outside the organization, other blocks that you can see here relating more to internal processes where collaborative efforts are going to be needed to change. I'm going to speak for a moment here on ways that telehealth seems to be easing factors contributing to burnout. One is increased flexibility for clinicians. Of course, this is going to be helping with work-life balance and workflow, fewer missed appointments. This is helping with productivity and on the financial side, quality of care. We're not switching the slide yet. We're going to stay right here. Okay, thanks. We have the potential for more patient contact during a day, which provides meaning. It's what physicians want to be doing. There's time saving for the providers in commuting between facilities. That also helps with that work-life balance piece, a reduced exposure to infection, better access to care. And these are examples of where telehealth is already contributing to reducing contributors to burnout. On the sort of con side, and where there's some more policy and work that needs to happen, and there are, and we're seeing that, and surveys do speak to what is happening. Frustrations around inefficiencies can happen where there's Wi-Fi or connectivity technology issues. And I would suggest that, remedies which I've actually seen, not just my ideas here, are that staff may triage to help ahead of time to make sure that that patient has that connectivity and that some of the technology glitches are worked out. Resistance to change is a problem. And I want to thank Nate Creer, who's a CTEL member, for his dissertation and work on this. There's a lot of resistance to change in healthcare, probably because of excessive workload. Oh no, not one more thing. Leaders can be very helpful here, as Nate has found in his research. And thank you, Nate. There's a lack of clarity in reimbursements as a cause of stress in terms of use of telehealth. And of course, that's related to the bigger issues of advocacy. There's some concern raised in surveys around, is this impairing, the examination of the patient, and, which could create issues around quality of care and autonomy for the physicians. And I would suggest that policies look here towards that direction physicians already want, of giving them agency in determining when a visit is going to be in person versus virtual. And then we look at that autonomy and agency piece. The lack of human contact, or, our telehealth sessions more impersonal. These are issues that I think education and work-life, self-care can be helpful in. So that's a quick overview. This is telehealth is doing a lot already. And so you can pat yourself on the back, but there's more that can be done in the areas of professional growth, self-care, interpersonal dynamics, and conflict resolution. Next slide, please. So this is all very important because we do also have a body of studies. There's an excellent site there by West, who looking at cross-sectional studies that have linked physician burnout to very costly patient care issues and increased risk. This is around, medical errors. Studies are looking at like a doubling of medical errors. Other studies, even pre-COVID, looked at medical errors, and about 70% or more in studies are attributed to dysfunctional team dynamics, which is also worsened in burnout. And we'll get to some of the reasons for that later. Increased claims. Studies are showing about a 17% increase in claims. I expect that number may rise as time goes on here. And patient dissatisfaction, that's a very hard one to assess. Even there's some studies looking at burnout impacting recovery time and mortality for patients. Again, more research to be done in these areas, but these are serious concerns. Next slide. So we've heard a lot about this word resilience, and back in that Wellness 1.0, that polarity, don't tell me to do another yoga class, don't tell me to do another resilience class. We're among the most resilient people on earth, and that is true. Healthcare workers are among the most resilient, and psychological flexibility and resilience, which are words you're going to hear me say today, are very well studied in psychology and neuroscience research, and they are very protective against resilience, not bulletproof, but very protective. In fact, higher resilience scores are associated with lower risk of burnout. However, this complex brain phenomenon, which we call resilience, psychological flexibility and resilience, is not static. It's about the capacity of the brain and how we respond, adapt to, and learn from and recover from stressors in our life. Most programs we see out there around that recovery part, the stress relief part. But psychological flexibility and resilience is about how the brain responds in the first instance. That response can be degraded and over by persistent stressors, and it can be ameliorated and learned over with guided practice. But there's basically a lack of education in how to safeguard this attribute of resilience. And in fact, we're seeing, this was a Press-Ganey study that you're seeing here, resilience is on the decline in all roles. This is worrisome because, again, it is an attribute that clinicians and others hold dear. And also the ability to decompress at home is shown in this survey to be on decline. And other studies, not the Press-Ganey, but previous studies, have looked at most clinicians don't know how to reduce distress and symptoms of burnout. Next slide. So we've got in Wellness 2.0, we're advancing, as Tate Shanafelt would share with us, on a number of fronts, and looking at no longer is there the idea that clinicians are expected to be superhumans. They're humans. We make mistakes. We're subject to pressures. We experience reactions to all these stressors. And the Joint Commission has weighed in on healthy work environment here to emphasize that these points are part of that effort to tackle the system drivers of burnout. So you're absolutely looking at what are the contributing factors and supporting institutional resilience as well as individual resilience, providing education that promotes psychosocial well-being and stress management, and that cultivates open and transparent communication that fosters trust, morale, psychological safety, and so on in the workplace. And these are foundational to a healthy work environment. So in this exceptionally high stakes environment of healthcare, average abilities, what we happen to learn along the way at school or from mom and dad, average abilities in coping, communication, and interpersonal skills are not enough. And the science is here to acquire exceptional skills, increasing our awareness, our assessment, and our choice in our stress-triggered responses, in cultivating our skilled communication, and in authentic collaboration and leadership. And there are effective methods that, again, are studied over there in psychology and neurosciences that we can bring here for effective methods to have more choice in how we are responding to our stressful environment, aligned with what our own values, what matters to us. Okay, so the science is here, and fortunately the training now is as well. Next slide. So this is a depiction of a new paradigm. We're going to call it the resiliency growth paradigm, and leading through this complete approach, where we have the system redesign that must look at the contributing factors to burnout on one side, the teams on the other, and they are not isolated. Let's go to the bottom of this depiction here. This is the foundation of resiliency growth and supported by the science here, that there's a formal training program, peer support, and coach mentor options for people. This is about building a resilience toolkit, action-based learning in its kind of formal training. It's self-paced, experiential at its core, where people are developing proficiency in best practices, intervention strategies that they can immediately apply, very practical. We're talking about cognitive, behavioral, and physical strategies that are grounded in leading therapeutic models. Coaching builds on these skills to provide an effective interaction for growth. It can be done virtually, in small groups, one-on-one, or even in private online communities. And peer-to-peer interaction is also supported by the research in reducing burnout. So there at the bottom, at the base here, you have this resiliency growth that now informs leadership, providing leadership and culture, allowing these to evolve and have best practices, skills under the belt to lead to more effective collaboration. And with more effective collaboration, you start being able to problem solve those really complex, difficult issues that are contributing to burnout, put out those fires, and better take care of your teams. And again, this kind of growth is aligned with the values of the organization, what matters to the individuals and the teams. Next slide, please. So key elements in looking at a digital health intervention tool like this, these are all crucial elements for success. So the first, that there is a core program that is active, kind of a formal education around these more advanced skill sets. It should be people should earn CEUs for doing this and protected time. You want to provide on a platform that there is that opportunity for community networking and for leadership. It's got to be really easy to bolt in, because otherwise no one has the time to learn. So it needs to be turnkey tool. It should be strictly grounded in the research. And there's a lot of wellness tools out there that are not, and where privacy is also a concern. But so one of the must-haves is strict privacy and anonymity to the learners in tools like this. We also want to have ongoing support. The way that the brain changes around our stress-triggered responses and around our communication is incremental learning. This is small bits over time, really minutes a day, and that is important to have follow-up. Follow-up doesn't need to be as frequent, but that there's also ongoing support. So these are some of the critical areas, components you would want to see in any resiliency growth program that you're looking at. And that it is also very interactive. So that's very important. Next slide. So we're going to have to dig a little bit into what happens here under stress. And there's not enough discussion about this. It's, in some ways, I see it as the elephant in the room. The adverse effects of chronic stress are particularly common in humans. With our high capacity for symbolic thought, we elicit stress persistent responses to a broad range of adverse living and work conditions. People attempt to cope, but too often they learn maladaptive, rigid patterns of coping to stressors. And these are some examples that you see. And these are in several different domains, in thoughts and feelings. The thoughts, they're not competent. They'll never get this right. They don't listen to me. Or feelings like worry, anger, rage, frustration. Behaviors, and this is the area of stress triggered responses that really gets in the way of interpersonal skills and interpersonal dynamics. And as you look down this list, I'm sure everyone can nod their head and has seen this any number of times. In the physical domain, stress triggered responses can lead to fatigue, poor sleep, insomnia, and other numerous. These are just partial lists of research-based responses to persistent stressors. And this creates a vicious cycle of stressors, persistent, frequent stressors, stress-triggered responses that often become maladaptive and not aligned with how we want to be seen or how we want to, what we value. And then the stress worsens. So there becomes this importance of how do we break this cycle? On the individual level, this is harmful, causing even more distress and exhaustion and symptoms of burnout, poor performance. And the organizational level, resulting in higher costs, lost revenues, and reputation. And the patient level, potentially compromised care. So getting at how do we change, how do we break this vicious cycle? Next slide. Fortunately, we've got decades of research on this. And those of you who are in HR or in psychology will be familiar with this, integrating leading intervention strategies here to safeguard, protect resilience, and build our psychological flexibility and resilience. We see the mindfulness-based approach, flexibility-based approach, acceptance and commitment therapy as showing very durable outcomes, particularly with an integration with cognitive behavioral therapy and more traditional stress relief practices like meditation and other stress relief. So that's the core of intervention strategies. Fortunately, these can be taught online. So let's go to the next slide. So what's missing in the pool has been a gap in formalized CME, CEU training programs that in these leading best practices interventions. And these can be readily learned online, minutes a day, over a period of about 4 to 6 weeks. Most of the research would show, some a little longer, not less. It's immediately applicable. These are very practical, pragmatic intervention strategies that should be reinforced by ongoing training, peers, and coaches with durable outcomes. This allows for a common language among teams to be able to speak together, reinforce, and model with each other. And of course, being on a digital health tool, it can be offered at lower cost. Now, among the research-based benefits of psychological flexibility and resilience, we see improved vitality and energy, higher levels of work-life satisfaction, fewer mistakes and accidents, improved problem solving and cognitive functioning on many dimensions, more effective communication and teamwork, and lower risk of substance abuse, reduced symptoms of burnout, and reduced healthcare utilization. So these are just highlights on the benefits related to maintaining and improving our personal psychological flexibility and resilience, as well as how we start to advocate and collaborate with others. I'm going to have you go to the next slide now. So as we start to look into platforms, what we have used in our program is interactive video technology in an incremental personalized learning approach for durable change, consistent with the research here on this, and aligned with personal value directions and what has meaning. Interactive video technology allows these in a self-paced learning to interact directly and have responses stored in a private journal right within the program that can be referred to, amended, and adapted over time. And in our case, we provided a series of videos that people are learning and interacting with to cultivate and personalize intervention strategies for themselves. Next slide. These are just a few more, a quick view of the kinds of other cognitive, behavioral, and physical benefits of psychological flexibility and resilience. Next slide. Digital platforms can also provide secure peer communities and coach mentor interactive tools. And the research also does support that these are helpful toward reducing distress and burnout in the workplace And with platforms, you can make this much more secure than we see on many products that are out there where the selling of personal data is one of the profit centers. You want to be very mindful that in developing a program, selecting a program, that you're looking for programs that have very strict privacy around the peer communities and the coaching platform, but it's another exciting way to, at a low cost, extend access and inclusion to the larger workforce. Next slide. Digital platforms also have the benefit of being able to, centralize resources, such as stress relief or building on the skills, more programs that you may want to introduce, or workshops, other things you may want to offer can be done on digital health platforms. Next slide. So these are just some of the metrics that we look at. We gather pre and post metrics. We now have added the Brief Resilience Scale, which is a validated assessment in our tool, but we also have the AMA PROC Category 1. Our accreditation partners have evaluation surveys. Just a quick, these are a few. Overall, how would you rate the program? We had 90%. This is an N of 100 that we took a deeper look at. A 90% rating it is excellent, very good, 10% good. Ability to apply 3 or more evidence-based strategies in the presence of a stress-triggered response, 100%. Progress in your ability to flexibly conduct your life in ways that align with your personal values, 99%. I'm glad to share other metrics that we have, and you can just contact me after the program. But these programs, growth programs, are a way to show value to your entire workforce by helping people acquire the more advanced forefront knowledge on how to cope, communicate, and function in this high stress occupation. Next slide. Now, there's much harder to assess benefits. We're going to start looking at, value proposition and ROI here. These are the hardest to assess. You'll see these mentioned in the AMA steps forward, mitigating risks. Okay, so we showed you that there's research showing that maintaining higher levels of psychological flexibility and resilience is associated with fewer errors, accidents, and health utilization, for example, and symptoms of reducing symptoms of burnout, improve work-life balance. Okay, those support improving retention, decreasing mitigation, but how do we factor that in? It's more difficult to do, but the thought leaders in this field, the Joint Commission, AMA, are urging you to look at these, to factor in the benefits of improved retention, improved teamwork, entity resilience, reputation, and reduce mitigation risk by offering burnout interventions in this professional growth area. Next slide. One of the benefits, of course, of digital tools, it allows for lower cost and rapid scaling. You've probably heard me say many times now, I'm very much an advocate for looking at the whole workforce. We saw very in the beginning the enormous levels of stress, very high levels of stress in lower wage earners. Those people are essential to ease the burden on your nurses and your physicians and the whole team. So we want that kind of rapid scaling. Next slide. And easy onboarding. So looking at the value proposition here, let me try to explain this slide here. The value proposition, we're looking here at a scale that's looking at professional development tools that has that foundation of that paradigm, the professional training, platforms for peer and coach interaction. So looking at tools like that, weighing and balancing. Of course, this is going to vary with different programs. These are based on our numbers. The cost of replacing one nurse, my apologies. And the cost to provide that kind of a growth program to, you know, more than 1,000 healthcare workers on your team. If the resiliency growth training tips the scale to keep that one nurse, it pays for itself. If you replace that, the cost of replacing one doctor, you're going to be dealing in several thousand people you will be able to train if you're able to train that one nurse. So if you, that one doctor, if you start factoring in all these other factors, reducing risk, mitigation, improving your patient satisfaction, the numbers start jumping in into the many tens of thousands you can train. So this is a way to look at this. We need, of course, more research around ROI, but these are some numbers that I hope are helpful for you. Next slide. It's quite easy with digital health platforms also. If they've been well built and well developed, they can be turnkey. They're able to track metrics anonymously and provide reports. All the organization really needs to do is make that commitment to adopt a program with minimal administration time, implement it, incentivize it with their workers. Some of the ways that can be done is by earning CEUs, points. They receive personalized toolkits, and there's other incentives that you can bring in. And then third, evaluate the program, look at the metrics and reports on how it has gone for your organization. Next slide. So quickly, before we close, what conveys value to your healthcare workers? What are drivers to stay? I mean, this is important to look at. We have a large recent study by Press-Ganey on this point, and here you can see some of the key areas to look at for around what conveys value, what are drivers to stay, opportunities for professional growth, knowing the organization will be successful. That surprised me actually when I saw this. And everybody shares that, don't they? That's really saying the organization is resilient. Everybody wants that. And these others, don't we all want to be treated in this way, you know, to feel that we're in a respectful, trusting environment, that our work is meaningful, that we have input, that there's sufficient reward. And that's not just monetary reward, though that plays a part, and that your work life is supported, and that you have functional dynamics with your teams. So these are drivers to stay. And I think that together with looking at the challenges, it can help us think out of the box and be stronger advocates in how we make those subtle changes. Next slide, and then we'll be closing and opening up for questions. So my final parting words are you to invest in your teams, your leaders, and your staff with a complete approach. Forefront interventions and interpersonal skill building takes just minutes a day over maybe 4 to 6 weeks with ongoing support, coaching, and peer that can be very easily administered through a digital health intervention platform. All-inclusive fees on something like this for the StressPal Frontline Toolkit are around $15 per learner per month, like less than the cost of a latte a week. And there's a solid turnover in ROI. Plus, if you factor in the lowered, risk mitigation, improved performance, better reputation, you start looking at numbers that help support that reason to invest and create a great place to work. We do have an experiential demo. You can take a look at that, follow the link you see down here, and I'm always happy to answer questions now. And reach out if you need to reach me at Penny at StressPal. That's PENNIE at StressPal, or the email you see below. So thank you. I will love to hear your questions and take a few minutes for that. We can stop the slide now. Thanks. Okay, so Ben can take a look and see if we have some questions.
Penny, thank you for the fantastic presentation. And again, we encourage you to submit questions in the chat or to join with audio and video if you have any questions. But Penny, I know you noted that for these types of resiliency tools that there's a significant return on investment. Can you kind of share where that investment comes from if you're able to kind of keep certain clinical staff in their jobs for as long as possible, and not only in their jobs, but happy and effective, efficient workers as well?
Okay, sure. Yes, I mean the core of this is around as we bring together advances and leverage those advances from neurosciences and psychology to help enable people to have these skills, these capacities that they can bring to the table in the middle of high stress situations. They're going to have that opportunity to have better work-life satisfaction, better teamwork experience, and more job satisfaction around the those elements that are important to them. Those can contribute to retention, and retention, of course, we know is impactful on a return on investment. But also, and importantly, it's around that more effective collaboration and risk mitigation, because those spiral into that vicious cycle we talked about before, creating more distress and stress for the worker if there's claims, problems with patient outcomes. So you have that piece. And third, you have that effective collaboration, that more effective opportunity for more effective collaboration to tackle those larger issues, those members of the team and those members of the clinician team who can be in a position to self-advocate, to start feeling that benefit that we're making a difference, that we're starting to address those bigger issues and we're making some progress. These all speak to retention and potential lowering of risk, and a lot more research is needed on this area. We'd love to be part of that research if any of you are interested.
Fantastic. Are there any other questions from our attendees today? Wonderful. It does not sound like it, and we're getting close to time, Penny. But I know if people are interested in learning more about StressPal or any of your studies or research relating to resiliency, we'd love to be able to connect you. So please shoot me an email, and I know that Penny shared her email as well earlier. But Penny, maybe I'll hand it off to you for some closing remarks.
Okay. Well, I want to thank you all for being here today and commend you for the work that you are doing at your organization to support a wellness culture, a culture of wellness. This is a very challenging time that you all face in healthcare, and each organization will have its own particular way of approaching this. So I encourage you to think about the multifaceted nature of an approach and taking on changes. There's one to get rid of the stupid stuff first. Well, that's one thing you want to look at, and how are those ways that you can support your broader team and allow retention across the entire workforce through professional growth programs that are digitally administered, so that you can really spread the benefits to your larger group and provide that inclusion.
Wonderful. Well, thank you again, Penny. And again, if people have questions that weren't answered this afternoon, please shoot me an email, and I'm happy to connect you with Penny. But Penny, thank you again for sharing your expertise, and for all of our attendees for joining us today.
All right. Thanks so much.
Thank you.
Bye-bye.